Hello everyone, welcome back to my channel. So today we are going to continue our topic, that is GERD. What is GERD? GERD is the gastroesophageal reflux disease. As the name indicates, it is a reflux of content of gastric to the esophagus which will lead to a disease. So what is normally do? There is a stomach and there is a esophagus. A sphincter is present here which prevents the backflow of the content from the stomach to the esophagus. When there is a problem in the sphincter, it will lead to GERD. Either the tone is decreased or inappropriate relaxation of the sphincter, which will irritate the distal one-third of the esophagus, and inflammation will take place, which will lead to esophagitis. Esophagitis, word itself indicates itis means inflame. Esophagus means the inflammation of the esophagus. So what is the normal pathophysiology of the GERD? We have a esophagus and the stomach. When we take food from the mouth, a normal peristaltic movement takes place which will lead to the food from upper esophagus to lower esophagus then to the stomach. But when this tone decreases, there is accumulation of food here and it leads to the prolonged exposure of the contents of the food which will irritate the wall and inflammation will take place. We already discussed why this GERD takes place. Either the lower esophageal sphincter tone decreases or inappropriate relaxation of this sphincter. Now we will discuss the risk factors of GERD. First is hiatus hernia. So what is hiatus hernia? We have a esophagus, we have a stomach. Hernia means bulge in the mucosa or submucosa. So when this bulge takes place either in the esophagus or in the stomach like this, there is inappropriate peristaltic movement which will accumulate the food here and a prolonged exposure takes place. So in the 30% of the patient, hiatus hernia will lead to GERD formation. Second is defective esophagus clearance. When the clearance will not take, it will lead to GERD formation. Then raise intracranial pressure. Intracranial pressure will lead the food moving upwards. It will force the food upwards. Fourth point is gastric content. Means the acid will release in the more amount, and it can be due to like eating spicy food, or the enzymes are secreting in the more amount, like bile is secreting in the stomach in the inappropriate amount. Next is dietary factors or patient related factors. Patient related factors means like the patient is taking alcohol, fatty foods, smoking, chocolate. So these are the risk factors of the GERD. In the next video, we'll discuss about the clinical features, investigation, diagnosis, treatment. So this will be the end of this video.